Shoulder. Okay.
So you have an answer.
So I'm just testing very quickly. This is not a proper. This is not a proper assessment. I'm just doing it for the sake of this.
Yes.
But I did radial nerve tension test. Shall we do the same on this side? Right? Internal rotation. There's more range, no tension. But on this side, when I did radial nerve tension test, she felt more tension up here. Good. Could you turn your head very gently to the left, then to the right, to the left. Relax. I will do that for you here. So you work on your head. I will look after your arm. Okay. Good. Now towards me. Look towards me. Good. And again away. And more. Nice game, isn't it? Have a go. Turn to the other side. Quick. And back. And relax. Neural guiding. That's mean if the symptoms decrease now, it means the problem is not lateral epicondyle problems, it is radial nerve tension problem. Could you move, extend your wrist again, please?
Yes,
There is pain. More?
Same.
Same pain. How is that? Do it again that way.
No pain.
What does it mean?
During the inflection.
During slight inflection,
There's pain.
there is pain.
Extension, full extension.
Extension, no pain.
This muscle working.
Keep going. Keep going. And you just thought this is what we call clinical reasoning, isn't it? Yeah? Do it again, wrist extension. Again,
Yes, there is pain.
there is pain. Push my hand,
B.
Yes, there is pain.
there is pain. What does it mean?
Combine this one.
Pushing up, feeling the pain against resistance, it is myogenic. Right? It is muscle related. But also there is definitely neural element. Why? Because radial nerve tension test here was positive. It gave her symptom around the shoulder, but it gave her nothing around the other side. Good. Let's use a tape then and see how tape can happen. I use this tape. I use this test. I took it from a colleague from Netherlands, and since then I use it and it works. I don't have an evidence. My only evidence is related to our anatomical knowledge. Everyone knows the fascia. Fascia is a network, heterogeneous. It has no alignment. Yeah, it's non-contractile. It doesn't contract, but it is type of connective tissue. It is a type of connective tissue, and the tissue, this type of tissue is quite thick and stiff if we are not moving well, and sometimes it can irritate the nerve endings. So if there's a nerve passing around it and it's not moving, it can irritate the nerve. It is a theory of basal anatomy. If we do it again, very gently wrist extension. And down. How's that?
Little pain.
Little pain only. Okay. I'll just take the soft tissue and the fascia and move it in. Very gently do wrist extension. No pain. This means this test is positive. It means if I take the tissues to maintain this position, it might help her to extend with this pain. Did you get this?
Yes, sir.
If not, I will try the opposite side. But 90% of the cases, they do respond for moving the tissues from lateral to medial. Don't ask me what's the evidence. The evidence is the clinical evidence that you can see right now. But it might be, if you're going to do a master program, it might be a good research project here. Having people with tennis elbow and do this kind, you can call it fascia test, whatever you call it side test, doesn't matter, okay? And just push the soft tissue in. My theory, I'm changing the alignment of the fascia and soft tissue, which could be adding pressure to the nerve endings. Move up, no pain. This could be an indication to use tape to support the fascia in this position. Shall we do that? Is it okay?
Make it.
But this one not needs pure tensile, right?
From my point of view,
Combine.
there's nothing called pure tensile,
Combine.
correct? And there's no inflammation of the tendons that can happen, right? So it's a combination of different things. What's the only network in our body? What is the only network in our body? Neural tissues. Peripheral central nervous system, peripheral nervous system. Fascia is not a complete network because it has a gap. It has a gap. Good. Muscle. I didn't hear about a muscle connecting neck to foot. I don't think anyone invented this muscle yet. But neural tissues, we could have a tiny, invisible, difficult to identify problem in the neck and giving you symptoms anywhere in the upper limb. The same for the lower limb. Any problem lumbar spine and give you symptoms on lower limb. What does it mean clinically? If you have any patient with peripheral symptoms, always go up and examine central, neck or back. Is it okay? Coming back to taping, because we are teaching taping here, I will just take a small piece of tape. The anchor will be down on the back of the ulna, and then I will pull the skin laterally. I will do a quick test first.
Yes.
Do it again, wrist extension. No pain, that's mean it will be successful. Alright? So I didn't even apply the tape. Small piece of tape. I will apply tiny stretch.
Start from that side.
Yeah, I will start from lateral. Tiny, nice anchor. Back of the ulna. I will manually correct the tissues. Push it laterally, push it medially, sorry. And then use the tape
To keep.
to maintain that. And then no pressure. You okay?
No stretch.
Stretch. No stretch, stretch, no stretch. Move up again. No pain. That's me. We give our plea a push by decreasing the pain. Now, your long-term treatment, right? And you will not get a long-term effect without doing what we call eccentric exercise. You know what I mean? So, let's say relax your arm like that. Water bottle. Would you mind to pass me this water bottle, please? Thank you. Just move your arm to extension. With the other arm, just hand the bottle to the other hand. Good. Now you are in full extension. Very gently go down to flexion. This eccentric exercise for the common extensors of the rest. When you go up, don't go up with the hand with water bottle in your hand. Take it off. Because I don't like her to go to extension with resistance, because this was one of the aggravating factors. Good. When you move down, so two phases. The down phase with the water bottle on, the up phase with the bottle. You okay with that? Thank you. Thanks for having me.
Congratulations.